So this is the PDF of the definitions that you need for Unit 1. So we'll start out, I'm just going to go through them a few at a time. So acute, a short, relatively severe course of the disease. Now short is a subjective term. What might seem short to the doctor may seem terminally long to the patient. Because of the severity. Chronic is persisting over a long time. We talk acute days or weeks, perhaps even a month. Chronic is kind of less severe, it persists over a long time. We're talking months, years, like that. A complication is a disease or condition arising during the course as a consequence of another disease. So a complication of, say, streptococcal infection and rheumatic fever might be damage to heart valves, which then will lead to a chronic heart condition. That chronic heart condition would be a complication. A fracture that is a compound fracture is complicated by an infection because the bone has broken the skin. Complications are a separate disease that is the consequence of a different disease. Convalescence is the recovery stage, and a lot of times people are in the hospital convalescing. Those are the people that you're taking care of. A disease is any deviation from the normal structure or function of the body, is manifested by signs and symptoms, which makes sense. Epidemic, on the people. Epidemic is a widespread outbreak of the disease within a specific population. Epidemics happen all the time. So there'll be an epidemic of influenza, or there's an epidemic of things. In sub-Saharan Africa right now, they're saying there's an epidemic of HIV and AIDS. This is opposed to pandemic, which is worldwide. It's like a big epidemic. And endemic is when it's kind of there in the population all the time. Like malaria is endemic in some parts of the world. The difference between endemic and epidemic is the suddenness. It's the outbreak. There's no sudden outbreak of malaria. It's endemic. Epidemiology is the study of epidemics. And there's a lot involved. Like you try and find out what the source, you try and figure out. And the idea is to prevent further epidemics, or to prevent the epidemic from spreading to different populations, different areas. In the other videos, we talk a little bit about some of these things. Etiology is the cause, the origin of the disease. So it's often the pathogen. It's the etiology is whatever is the trigger. It's the thing that makes the disease happen. So influenza virus causes the flu. Etiologies can be iatrogenic, or they can be idiopathic oftentimes. Homeostasis, the tendency for stability in the normal internal environment. Iatrogenic, resulting from the activity of healthcare professionals or a medical procedure or treatment. So things like corticosteroids causing diabetes-like symptoms, Cushingoid diabetes. Idiopathic is without a known cause. We've talked about that. Incidence, the rate at which a disease or disorder occurs. So the incidence is really the number of new cases of the disease that in a given period of time. So the incidence of uh, prostate cancer in 2016 are all the people that get prostate cancer in 2016 that are diagnosed with it. The prevalence, which is different, the prevalence of prostate cancer in 2016 is all the people that have prostate cancer in 2016. So those are the people that got it in 2016, and the people that got it in 2015, and the people that got it in 2014, and the people that got it in 2013, and so on and so on. So the prevalence is usually higher than the incidence unless people either get better from it or they die from it. So diseases that have a fairly short course, like influenza, the incidence and the prevalence are usually very much the same. Diseases that are really chronic, the prevalence is usually far higher than the incidence. Latent is dormant. The disease is there, but it is dormant. The term lesion means any disruption of tissue, pathological or traumatic discontinuity of tissue. Lesions can be things like scrapes and bruises, but they can also be tumors, anything that is affecting tissue. Manifestations are the signs and symptoms of the disease. And be careful, because a lot of times lay people especially, they use the word symptoms when they mean manifestations. Manifestations are the signs and the symptoms. Morbidity and mortality are linked as well. Morbidity is how sick does it make you, and mortality is will it kill you. So there are diseases like pancreatic cancer that has a high mortality but a low morbidity. It doesn't really make you very sick until it kills you. There are other diseases that have a very high morbidity. You get really sick from it, but it doesn't kill you. So a low mortality rate. Then there are things like Ebola, which has a high morbidity and a high mortality rate. So there are diseases that have high morbidity and a low mortality that are chronic and have a low incidence but a high prevalence. So lots of people have it, but fairly few new cases. And the people that have it are pretty sick, but they don't die. Pathogenesis is the development, genesis, the beginning, the development of diseases, the cellular events, the pathological mechanisms of the development of the disease. How does it get there? Pathophysiology is looking at the physiology in the disease states. It's basically the physiology gone wrong. Precipitating factors are often called risk factors. These are factors that trigger the onset of a disease or condition. A good friend of mine has rheumatoid arthritis, and she got the rheumatoid arthritis it started to manifest right after an acute infection that she had. She got really sick with an acute infection. The infection cleared up, and then the rheumatoid arthritis developed from it. So the precipitating factor was the acute infection, and that fired up her immune system, which started the autoimmune attack of the rheumatoid arthritis. Now, she was probably always predisposed to rheumatoid arthritis. She would have genetically had this predisposition, but it took the precipitating factor to make it happen. Uh, a lot of times, predisposing factors are genetic or lifestyle things. Um, so these things are important when we start looking at preventing diseases. So primary prevention is actually that, preventing the disease. And that's basically watching out for the precipitating factors from the risk factors. So getting people to lose weight and methods of coping with their stress and stopping smoking are primary prevention for cardiovascular disease, for instance, hypertension, things like that. Secondary prevention is involved with not risk factors, but early detection. So this would be things like mammograms for breast cancer screening, detecting these problems before they become full-blown problems, and dealing with them early before they become full-blown symptomatic issues. The tertiary prevention is what we tend to think of as modern medicine. These are clinical interventions once the disease is present. It's interesting when we're talking about it academically, primary prevention seems to make the most sense. Secondary prevention seems to be a really good idea, and tertiary prevention should be kind of the last resort. The reality of the healthcare system is that tertiary is kind of where the money goes. Every now and then, especially with certain diseases, the secondary will get some funding. And it's very difficult to get any funding for primary prevention. The links for those risk factors have to be really, really well understood and really well demonstrated before there's a lot of money goes to that. So things like smoking and that kind of thing. The problem is that it's easy to measure success in a tertiary prevention. You can statistically measure success over a group of people in secondary prevention. Primary prevention, how do you know they're ever going to have it anyways? So it's very difficult to keep score. This could be a whole discussion just on its own. Prodromal is when you just feel like crap. It's symptoms that are non-specific, that are kind of telling you that something's coming. Prognosis is what's the probable outcome? How's this going to go? Now, it's interesting. A lot of prognosis is what the patient wants to know. They really want to know what their prognosis is because that's where a lot of their stress is. But at best, it's an educated guess because of individual factors and so many variables. Prognosis is not a very strict science. Yeah, we really don't know a lot. you know. And it's funny, people want to hear that, you know, you have cancer, you've got 6 months to live. Why 6 months? Why not seven? You know, uh, how do you know? It's one of those things. It's just basically educated guess from statistical norms, I guess. Remission is the disappearance of the clinical manifestations without it being cured. Now, sometimes that's just by definition. It's kind of like when you have pancreatic cancer, you can go into remission and you have nothing, but you always have it. Like it's hard to remove the the label. A lot of times, psychological diseases fall into this category. Exacerbation is making things worse. Anything that's going to increase the severity of the disease or the manifestations. Sequelae are any pathological condition that results from a preceding disease or accident. Um, so this is not exactly like complications. This is kind of the sequel. It's the next thing that could happen. So it's the result from a preceding disease. So a person with diabetes and diabetic neuropathy and circulatory problems may end up with a lesion in the foot, an ulcer that becomes gangrenous, and the foot has to be amputated. Well, that gangrenous ulcer is a sequela of the diabetes. Subclinical is without the manifestations. Oftentimes, early in the course of a disease, it before the manifestations become apparent, it's subclinical. A syndrome is the set of signs and symptoms, the manifestations that occur as part of the disease process. Sign is objective evidence, and symptom is subjective evidence.